All right. Today I've checked my physician's orders, and he has ordered for our patient to have suction and a tracheostomy care, cleaning. I've washed my hands, and now I'll come in the patient's room and identify it with the name and date of birth. All right, Ms. Smith. Today the doctor has ordered for you to have suctioning and your tracheostomy and your cannula clean, and we're going to get the tube side changed and then the underdressing changed. All right, while I'm going to be getting up my supplies ready, I'm going to go ahead and hyperoxygenate the patient with 100% O2. I'll go ahead and get my red bag ready. First, I'll be getting my cup. All right. And then I will be putting normal saline in here. And for an open container, what I'll do is unscrew it, lip it into the trash, pour a little bit out, and then fill up the cup with normal saline. Okay, now I have a designated suction hand. Let's see, how the heck am I gonna do this? All right, now I have a designated suction or clean, sterile hand and a non-sterile hand. All right, first I'll take my non-sterile hand and then plug the tube up to suction. And I'll have the suction to 120 to 150 millimeters of mercury, and if it's a child, I would have to check my hospital protocol. And now first, I'm gonna have to start by testing the suction, and I'll do that into my sterile water, or normal saline. And then now I'll take this off, and then making sure not to touch the outer borders of the cannula, I will be advancing until the patient either coughs or I meet resistance, and then I'll be suctioning on my way out. Okay, and if I needed to do another swipe, another pass, I would have to hyperoxygenate again. But our patient's sats are coming up and the breath sounds are a lot better. So what I'll do is I will hyperoxygenate again. Okay. All right, and now I'll disconnect. And if I also had to do another pass, I would clean the suction out right here. Remove this, take off the gloves, perform hand hygiene, and dispose of all of my equipment appropriately. Okay, now I'll put on clean gloves. All right, now Ms. Smith, what we're gonna be doing is now we're gonna be cleaning your tracheostomy. All right, taking this off, and then I'll just be taking the dressing that is up under out. placing that into a red bag, and then I'll undo the ties later. Now I'll prepare my tracheostomy care kit. Before I put on my sterile gloves, what I have to do is I'll lift this normal saline again, and then pour half normal saline in there, and then normal saline in there, and then fill the other half with hydrogen peroxide in this one, and then fill the third container up with normal saline as well. Okay, now I have my non-sterile hand. Now I'll carefully take out the inner cannula. All right, and now I'll put it into the hydrogen peroxide saline mix, and then I'll take my wire brush, and then I'll clean the outside of the cannula as needed, and then put the wire cleaner inside. And then I'll soak it, rinse it in the normal saline. Okay. And now I'll take this out, making sure don't only touch the outside part of it, and carefully reinsert the inner cannula, making sure not to touch the borders. Now I'll be taking my swabs and in the normal saline mix, dampen them, and I'll be cleaning the base plate. Cleaning up under the base plate. And before I would have inserted the inner cannula, I would have to use these thin wire cleaners to dry out the inside of the cannula. Okay, and now I'll go to perform and change the dressing and the ties. we'll gently lift the patient's head. Making sure that the rope is not twisted in an uncomfortable position. Alright, and I'll take off my gloves. Dispose them in the red bag. And then I will dispose of all my equipment appropriately, and then I will document my findings.